Wife.
My computer wife.
All right, everybody should have permission to record. Let me connect to Facebook. Sorry, I feel like they're staring at me.
Hey, Trevor, I don't have permission.
Okay, I'll give it to you here in a second. I'm connecting to the stream real quick. Okay, we are streaming. Let me get you permission to record, Danny. There you go, sir. And we are good to go. All right, we're joined by everybody today, Thursday. Commissioner Shelton, you just got the county numbers. Would you like to go over those?
Sure, Trevor. Here we go. The numbers for the county is our total case count is 433, 300 confirmed, 133 probable. Negative is 3,625, 167 are pending, 183 have recovered. There have been a total of 7 deaths. Total tested is 4,119, and we contacted 2,509. And a few updates from the county on several questions that I've been asked is the rise in the COVID-19 cases in Ector County, are they due to the increased ability of testing and rapid results? And that's yes. And many who contract the virus have mild symptoms and may not even know of the possible exposure. The health department would like to stress to the public and the establishments to make sure masks are being worn, wash your hands regularly, and use hand sanitizer when hand washing is not available. And another question that's on everybody's mind, it seems, is what's the average age of confirmed cases? And in Ector County, it's ages 21 through 30. So that's what I have for today, Trevor.
Thank you, Commissioner Shelton. Russell, would you like to go over the MCH numbers? Russell, you're on mute, brother.
Thank you. My computer wife shut me off there. At Medical Center, 1,996 total tested. 171 of those have been positive. We currently have 15 in-house. 12 of those are on 7 Central. 4 of those are from Focus Care in Odessa. We have none of our patients are on ventilators. We have 1 on CCU, that's from Focus Care and Crane. We have 1,645 negatives with 180 testing pending right now. 180 tests pending and no suspects in-house. So that's still good for us, but we had 14 and now we just received another one. So that's 15 that we currently have in-house.
That's 12 in 7 Central and 3 in CCU.
Yes, sir. That's right. And I've got a report here I want to pull up. I'm going to try to be like the doc here and share a screen. I'm going to do my best. So let's see what we got here. Let's see if I can get that going. We have a report here that our emergency management coordinator, Amanda Everett, puts together for us every day. And this information comes from EM Resource, which is a program that all the hospitals in the state of Texas use to report data. And so what you see on your screen here is just your basic. Go ahead and go down just a little bit.
Okay.
I wanted to show 2 things right quick. This purple box here is listing the case count, and you can see at Ector County, Commissioner Shelton reported 300. So this information was as of noon today. But we're running this report every day to show what the confirmed case count is. I know my friends in Pecos County, that 111 looks pretty big, but you got to remember 65 of those are in the N5 unit there at the ECHD in Fort Stockton. So that 111 is a little misleading for Pecos County, but 65 of those are in the prison system. But this is a pretty far-reaching information here. I just wanted to share this just to kind of give you an idea of what we're monitoring and what we're seeing out there. Let's go to the next one if we can. This one is reported by all the hospitals on here, and these are most of the hospitals in our area, and there's some out of our area, but we run these because these are people we have received patients from in the past. But this shows a census of what's currently in these hospitals, and also it shows what their person of suspect are and what their positives are. So you can see right there at the top, medical center, 205 people in the hospital day, are 14, which is a little bit dated because we just received one, and then we currently have 37 vents available. But I wanted to show this because down at the bottom, you can see we kind of rate this on a stress score just to kind of show what the occupancy is. I was on a call yesterday with 8 other hospitals and the governor talking a lot about hospital stress and how hospitals are handling this spike. It seems like this is happening throughout the state. And I think the overwhelming message was that, and definitely here in Odessa with us and with Odessa Regional, that we've got good plans in place. We have surge plans in place, and that not one plan fits everybody. And that's why each hospital and definitely each area needs to work together just in case we get overwhelmed. And I think we have definitely been able to accomplish that in Ector County. I think we've been able to accomplish that in West Texas. But at the same time, it just seems that right now, this spike has got everybody definitely in the Austin, in the capital area, on high attention, just trying to make sure that these hospitals can handle what's out there. One thing they were very interested in is that we've been having regional calls since back in March with our partners, and they were very interested in those calls and how we've kind of got this webcast out there just to communicate good information and just to make sure that we're all aware of what's going on in each other's counties and these hospitals. They were very impressed with how we're all communicating with each other at the city level, the county level, the hospital level, and that they really appreciate the amount of information we're getting out. I just wanted to show this just so the public can kind of get an idea of how we look at this information, how we punch this down, and how this information flows into us to be able to make not only good decisions here in Ector County, but also in West Texas. And that's all I have on that, Trevor. Thanks. Appreciate the screen share.
All right. Stacy, would you like to go over the ORMC numbers?
Yes, thank you, Trevor. Odessa Regional has tested 533 individuals. We've had 34 who are positive, 485 negative, and currently have 14 pending. We have 3 patients confirmed positive in-house today. None of those are on the ventilator though, so that's good news. And that's all I have, Trevor.
All right, thank you. Dr. Sherivan, you have anything to add?
Sure. Thank you, Trevor. Can you let me share my screen as well? Thanks. Out of the 3 patients that we do have that are in our ICU right now, in our COVID unit right now, 2 of those were on a ventilator before. They were extubated, I think yesterday or early this morning. So that's a positive sign of 2 people recovering well from this disease process. So that's a good thing. So the thing I wanted to go over today is when you guys hear the numbers of total cases, probable cases, confirmed cases, pending cases, what is the case definition? What does it mean when we give you those numbers? I think that's important for everybody to understand. So for example, today, we heard from Commissioner Shelton, 433 total cases. 300 are confirmed, and 133 are probable. So let me explain these numbers first. First of all, this total number includes the confirmed and the probable. That's easy to figure out. The confirmed cases are the ones that are confirmed by using lab PCR. PCR is the test. That's the one that is sent to the lab. It goes through a growth process, a polymerase chain reaction and replication of the virus, and then a test to absolutely confirm that you have it or you don't have it. The only machine in our area at this time that can perform the PCR without a send-out is the one that MCH has that's operational, called the Cepheid machine. ORMC has one of those machines. It's not yet operational because we don't have the test kits yet, but we're in the process of getting those. Hopefully next week we'll have those as well. So the PCR test is the only one that can be listed as confirmed. The probable cases are those that are tested positive using the antigen test that's being done at Signature Care. This was one of the questions that came up earlier about the Sophia antigen test. And at that time, I had told you guys that I would find out more to get back to you. So I have been able to find out a little bit more. And that's the test they're running out of the Signature Care. I knew it was FDA approved. I didn't think we had it available in our area. So I said, that's not something we usually talk about. But it is something that is available at Signature Care. And the antigen test, it is a direct test. It's not an indirect test like the antibody, because the antibody is looking for something that's created in response to the virus, versus the antigen is a direct test. So it is 100% accurate for positives. But for negatives, it is only 80% accurate, which means 1 in 5 people that test negative using that antigen test could still have the virus, but it is listed and told to them as that you're negative. So that's important for people to understand. For that reason, DSHS, which is Department of Health for Texas, has told our health department, all the health departments, that the antigen test gets listed as a probable. It does not get listed as a confirmed. So those 133 numbers you're seeing, the vast majority of that 133 are the positive antigen tests that are coming out of Signature Care. Those 133 positives, remember there was many more negatives, hundreds more negative. Remember, 20% of those people that were told they were negative because of the antigen test could still be positive. Those people are the asymptomatic carriers that we talk about, that are out there that could be spreading this, and we don't know for sure. So I want you to be careful when you're deciding what kind of test you're going to get and how you interpret the result of the test that you're going to get. So that's very important to know. The word pending is used for those people where the test has gone to the outside lab to send out. It's gone to CPL or LabCorp or Quest, and we're waiting that 3 or 4 days to get that test back from them, the PCR result from them. That's the pending category. So the one other thing that the health department called me about yesterday, and I think I want to stress this to you guys, is you've seen this number go up very, very fast in the last few days. Remember, the health department had about 15 or 16 screeners. Those screeners were people that used to work in other job functions within the county. They could have been librarians. They could have been people that are working in the immunization clinic at the county. It could have been a bunch of those people. Now, as we reopen, many of those people are going back to their regular job functions. So the health department is going out and hiring new contact tracers. They're going to be hiring 15 or 16 new people, training them and getting them to do contact tracing. Even with that increased capacity of contact, I'm not going to say increased capacity, even if that replacement of contact tracers that the health department is doing right now, they still will not be able to keep up with this volume. Yesterday on the call, they told me that the only ones they are able to contact trace right now are the confirmed cases. They haven't touched a single file out of the probable cases. So that 133 probables you see here, they have not had the, they don't have the capacity to go through and contact trace those 133. So there's a lot of positives out there, positives from the antigen test. There are a lot of positives out there that have not been contact traced. Remember, these guys are contacting several dozen people for each person that turns positive. So take that 133 and multiply it by whatever number you think is appropriate for contacting. That many people could be walking around with the disease process in our community, and they have not been contact traced, which means they don't have the information to isolate or go get tested or anything like that. So we need to understand that this is pretty serious at this point, the way it's rising. We need to be pretty serious about the actions we choose to take to continue to stay safe and protect ourselves. And we need to understand what the limitations of our health department are.
They're doing it through businesses. You know, I don't see as far as just police being around out writing tickets for not wearing a mask. So I'm doing some research into that, and I'll be able to look at that and kind of give you a more educated opinion on Monday. But from the city, we just really want to thank the health department for all their hard work. Russell and his group at Medical Center have done a fantastic job. Stacy and her group at RMC have done a fantastic job. And we appreciate everything you're doing. This is a lot of times thankless work, but on behalf of the city, we really appreciate everything you're doing, and can't tell you how much we do. So that's all I have for today.
All right, thank you, Mayor. Looks like we got full house today. Dr. Benton, would you like to add anything before we get to media questions, sir?
I'll try not to prolong it too much. I think just hitting on a couple of things that have been brought up. Yes, increased testing probably does drive our numbers a little bit. However, increased positive tests mean we have increased burden of the virus. So the virus is certainly appears to be more prevalent right now than it ever has been. So going back to what y'all are talking about with the mayor, it's incredibly important that we wear our masks, both parties. The person that I'm talking to, and I need to wear mine as well. The other thing is there's a bright side to this, and all of the data that Mr. Tippin presented, that we're not overrunning critical care. And bright side, Dr. Saravanan mentioning that those have recovered, 2 came off of the ventilators, fantastic news. So, you know, I'm not advocating that we go crazy and forget what we're supposed to be doing for social distancing and masks, but there is a bright side to this, that we're not seeing an overrun of critically ill patients.
Thank you very much, Dr. Benton. We appreciate that. Let's go to Mike Merlot, Odessa American. You're first up.
Hi, and this question is from a reader. It could be for Dr. Benton or Eddie. Is the health department getting enough help from the city? And does the health department need more contact tracers? I know Dr. Saravanan kind of talked about that previously.
Well, I'd say yes to both accounts. The city's working well. They include us in everything they can. They were instrumental in our drive-through testing. So there's no question that we're getting plenty of help from the city. And as far as contact tracers go, I mean, Dr. Saravanan, stated the obvious. I mean, as we opened up, we did send some of our contact tracers back to their original positions within the county. We're currently reaching out to organizations that provide contact tracing, and we're also have jobs posted for contact tracing. So we do need more, and I'll let Dr. Benton explain further why we need more.
Yeah, I think Dr. Saravanan hit that too, right? But each person that is positive potentially infects up to 4 or 5 other people, but they contact even more people than that. And those people need to be notified that they have been in contact with a positive person. So it's very, very important to have these people working in contact tracing. Yes, we need it, certainly as the numbers rise, but also, there are other things in our community that the health department needs to continue to do and provide too. So as the cases ramp up, someone mentioned vaccination clinics and things like that. We need to begin thinking about those, how to staff those things too.
And the problem with using part-time contact tracers is the amount of training that goes in to kind of get you to know what to do and how to do it. And then there's investigators that go along behind the contact tracers. So there's a lot to it, and we're actively trying to find as many as we can.
Okay, and that was actually the question I had. Are these kind of full-time gigs, or are they part-time?
Well, I'd like for it to be a part-time gig, meaning that this thing is over. But as long as we're having testing, we're going to have contact tracing.
Okay. Okay. Is there anywhere folks can go to get information if they're wanting to apply for that job?
Yeah, we have it posted on the county website.
Okay. Thank you, Eddie. Appreciate it.
You bet, Michael.
And for Mayor Turner, I guess it's businesses, they can require people who come in to wear masks and employees. That's correct?
Yes, I mean, it's typically a company policy.
Right.
Restaurants here, especially franchisees and your corporate restaurants, hear from their headquarters what they want. My stores, yes, that's what they've mandated, but it depends upon each business. And so I believe what the San Antonio ordinance did was mandate that.
Right.
So, that's, like with Twin Peaks getting the cases there, it was up to their corporate to come down and say, this is what you're going to do.
Okay. So it's not really up to you as someone who has a business. It's not up to you to require your employees to wear masks?
It is, because we get guidelines and you can always go further than the guidelines.
Okay. So do you require your employees
Yes,
to wear masks? And do you require customers to as well?
We haven't required customers because that didn't come down from headquarters.
Okay. So that's why if it did come from headquarters, but you could, right?
We could.
Okay. Is that something you thought about? Do you think businesses?
We've thought about it. Part of it comes to accessibility to masks, because when we first started this, you couldn't get masks.
Right.
And now you start seeing a lot of people with the cloth mask, and there's talk about a mask push in Odessa to be able to get and supply more cloth masks, maybe through volunteers, through charities, to get, because not a lot of people sew. And so that's typically an older demographic, but that's something that's in the works right now.
Okay. Well, thank you. That's all I have today.
Thanks, Mike. Let's go to Danny. Danny's next.
All right. Is there any plan to train any other of the school nurses with school coming up for kids that may for testing in the school district? Anybody could answer that one.
So Danny, I'm going to just jump in here. I hope you can hear me. I'm on the phone today. We are working, there's several of us from Medical Center that are partnering with the ECHD leadership to discuss the building readiness, the staff readiness, the testing capabilities, the flow of those things. So while that is a for sure answer of ECHD, we are working through those things with them. And so some of them have just not been, the plans are not finished yet.
So there will be a kind of like a kind of a policy of or protocols that the medical community and the school district will kind of engage in and set some guidelines?
I believe so. The school is working very hard to get the TEA guidelines and work through those. The leadership at ECHD has just been full force. So we'll continue to partner with them and ensure that they have all those things covered.
Okay, that's all I have for today. I'm good.
Trevor, you're on mute.
I'm trying to reconnect to Facebook too. Sorry about that. Up next, Scott, CBS 7.
All Are y'all good with the governor's aggressiveness, it seems, this last week about quote unquote getting back to normal, especially with the school announcement today? Doctors or CEOs?
I can give you a little bit of insight on that. The one thing I do want to say is the governor is looking at those numbers that Russell showed earlier, the report that goes into EM resources. They're looking at total number of beds. And they're looking at us going from between the normal to the medium stress category. You do have to remember that we report every bed that we have. We report the surge capacity that we have, but we don't staff every bed that we have unless we have patients. So although that capacity exists, and I'm not refuting the fact that the governor said about the beds being available for people when they get sick, the issue is also staffing. And there's many different aspects to taking care of the patients that's more than just bed capacity. So with regard to bed capacity, which is what's published out there, sure, we're at a position where we can handle a little bit of a surge. Not if it continues to go up aggressively, but we can handle a little bit of a surge. But if it gets to that point, remember, staffing is going to be very stressed. We are going to have to bring in staff from other places, from agency, from within our corporation, like stewards sending other nurses from other hospitals down to us, like we did for other hospitals. A lot of that will have to happen in order for us to take care of the patients if every bed is full that's listed there.
You're okay with that? Or do you think we should reassess if we're heading in that direction?
No, I'm not okay with that. I don't think we should get to that point, because that's putting us at a point that we are going to be very stressed. And that's not a point we want to be at. We want to be in the normal category. We don't want to be in the stressed category. Stress is not normal. Stress is out of the norm. So
you don't live my life then, do you?
So as a hospital, that is the right place to be, is, just right kind of staffing is what you need as a hospital. As a community, that's what we need. So we have to be careful as a community not to let this rise too fast. I'm not against reopening stuff, and that's something I've said over and over again. I am all for getting back to a normal. Not the normal that we are used to before, but the new normal that we're going to be used to with coronavirus in our community. So I'm all for that, but we all have to be engaged in that conversation together. We all have to have that social contract together, saying, I'm not going to get your grandma sick and you're not going to get my grandma sick, so I'm going to wear a mask. You're going to wear a mask. We're not going to have big social gatherings. All those are very important conversations for each of us to have. Now, if all of us are engaged in that conversation, we understand how to get there safely. Absolutely, I'm all for reopening, but not the rate of rise that we're seeing now. That's not normal. The stress level will increase quite fast in that chart that Russell was showing earlier. Feel free to add in anyone else.
Anybody else
I
want to
agree.
know that?
I agree. I mean, we have to somehow find balance. The virus is not going away. I anticipate it's going to be here for months ahead. Again, that's why I brought up the positive side a while ago too, that thankfully we don't have overrun of critical care patients. I don't want any patient to be sick with this. So I want to reinforce Dr. Saravanan's message. It's really us as a community, each individual coming together to do our part to lessen the spread of this, and in particular focusing on protecting the vulnerable. So, when you have it, stay home and don't go to work. Don't go to the nursing homes. Don't go to congregational living places, and try not to spread this.
We got a video a few minutes ago. There were 176 cars in line at Sul Ross this afternoon for a test. Chase, our assignment editor, and I were in Alpine Tuesday. They're freaking out because they had a little blow up after Memorial Day. And I just wonder, they all asked us, well, what's Midland and Odessa doing? And we were like, we're wide open. We don't see very many people wearing masks. Everybody's doing their own thing, but Alpine's kind of locked back down again. There was nothing open Tuesday afternoon. We wanted a good old Alpine lunch, and we had to end up at Sonic. So I just wonder if that's a little microcosm of what could happen here. You know, I don't think we have the same mentality of the numbers that Alpine does, but I wondered what y'all thought about, you know, they're flipping out a little bit down there.
Well, I would hate to shut down after starting back up. I think the governor's allowing us to open back up, but he's putting the monkey on our back. I mean, you can do it, but do it responsibly. And if you look at the average age of the positive cases, it's 21 through 30. I mean, so I think more education, let them know, hey guys, this is a real deal. And us as leaders certainly need to lead by example.
And I think we're going to have to be creative. You don't reach the 21 to 30-year-olds the same way in advertising that you reach, you know, say 40 and above. And we're going to have to be able to use media, especially social media and print media and TV and radio, to be able to reach them. You know, in advertising, you're always trying to hit those millennials, but they are so much different than us. They don't have cable TV. They don't typically listen to radios. They live online, and we're going to have to use more online to be able to get to them. And that's why we're talking about a mass campaign, and we're also talking about a media campaign. An RFQ, which is a request for quote, went out with some of the ad agencies to be able to reach those target people. And we're waiting for that to come back before we get started.
And I think that's our biggest fear is when we were on with the governor yesterday, the talk was about slowing down the elective surgeries again. And that would be disastrous for hospitals, not only here, but nationwide. And I know our friends down in Brewster County, down in Alpine, that hospital, when they get stressed out, they're going to start sending people this way. And that could change our number again, especially the number of ventilators and beds we have available. So although we appreciate their urgency, but at the same time, it comes down to each individual person masking up and doing the right thing. And just, if you're sick, stay at home. I mean, we've been saying that for 20 weeks now. I mean, just stay at home and don't spread it to the next person.
I think it's also very important that we add this one comment in about those probable cases that we talked about earlier, those 150 or so probable people. There's a lot of people coming to doctors' offices. I've gotten a bunch of calls over the last 3 or 4 days from private doctors' offices saying, hey, this patient's coming in and saying they were in contact with one of those people that tested positive. What do we do? Well, we've known the answer all along, but it's hard to give that answer to someone. Somebody's working, somebody's doing what their normal life is, and they come to you and they say, I think I've been exposed to a COVID positive person. Well, the right answer to tell them is, if you've been exposed, you need to isolate. But immediately, as soon as you say that, you're taking away everything that's going on in their life. You're telling them, stop going to work, stop going out, stop going socializing with your friends. And that's a very important thing for us to address. We are at that point now. If we can't make that difficult comment to our patient, and I tell the doctors this, right? I tell them, we are at that point now. You have to tell them that is the right thing to do. And then being exposed yesterday and getting a test today doesn't mean anything, because your test's going to be negative because you were just exposed yesterday. The virus hasn't had a chance to even replicate in your body. So the virus is not even going to come out several days from now when you get a test. So you're going to wait a few days before you get the test. You're going to wait a few days before you get the test result back. There's your 7 to 10 days already where you're isolated or quarantined. That's real. That needs to happen now. And I'm telling doctors that when they call me. So the community needs to hear this as well. That's the advice you're going to get, because that's the way we're going to control the spread of this disease.
Anything else?
I got one final question. It's completely different. We covered a news conference today by Dr. Richard Bartlett, who brought a patient that he claimed he had helped get better, who had coronavirus, with an inhaler of a steroid. And he is touting this treatment as almost a cure-all, as almost a miracle drug. He can't believe No one else across the country or around the world is doing the same thing he's doing. He's gotten media coverage of his idea, but I have a concern that there's no research, there's no approval. But this guy had an official news conference today with all 3 TV stations. And I just wanted to know, I mean, this is the official Ector County MCH-RMC call. Is that the right thing to do? To think that you have a cure and to tout it without any backup? And if you want to speak generically, that's fine. I don't want you to have to
It's
throw
okay, Scott.
a
No,
fellow brother doctor.
you're
under
asking
the
a
bus.
very specific question. I'll give you as specific an answer that I can. Sharing your research is what makes science science. So there is nothing wrong with sharing your research, sharing your findings with other scientists around the world. And that's the right answer. So there's nothing wrong with him sharing it. It's the manner in which it's received. Anecdotal evidence is different than double-blinded study evidence. All of us as scientists know that. When we go look at a study, if they say, oh, 5 cases all solved, magic pills, silver bullet, well, that's not how science works. You take thousands and thousands of patients across multiple countries, multiple sites. You blind them, you control certain people, certain treatments, certain people, certain treatments, and then you compare the groups. That's how you publish a scientific study. So it's not that he's doing something wrong. He's sharing what he found could be useful to the scientific community. Now it's up to the scientific community to look at that data, to do the proper research on that data, and to publish an actual statement that the scientific community can stand behind. If you go look at the NIH website, I think the inhaler you're talking about is a long-acting steroid. And there is specifics on the NIH website about that long-acting steroid that they are still researching, but it is not still approved for use because it hasn't been proven yet. So I'm glad he's having great results. Go ahead and save more lives, doctor, whoever you are. But just be careful as you're communicating this out to the public that doesn't understand when they think and they hear one person coming out and saying magic drug, well, they all go out and buy it. We've seen that before at several levels of leadership in this country. So I'm just saying, just be careful when you make those kind of statements. That's not how science works.
Scott, I would add this, that this is how research begins in medicine, though, that case series or case studies, just observations in general by us as physicians, is the starting place to build to an actual randomized controlled trial. So, but as Dr. Saravanan's saying, it's the controlled trial that leads to true evidence. That's when we should tout it. Interestingly, too, in the last few days, there has been a study out of Europe demonstrating that steroids do work in this illness. At least it was about 33% improved with the use of steroids. But those were either oral or intravenous steroids and not necessarily inhaled.
And they were for ventilated patients, right, Dr. Benton?
That's true, too, yes. So, you know, there is some evidence beginning to come out that steroids may be useful in this illness. And what you're referencing is the beginning of leading to research. So I don't think we should tear it down, but I don't think it's quite to the point of randomized controlled trial evidence.
That's all I got, Brother Trevor. But you got to turn your mic on.
The one time I mute, I can't do it. This whole day. Okay, Marcos, you're up next. Do you have anything, sir?
I just got one question for Eddie. Out of the average 21 through 30-year-olds, how many of those, what percentage end up in the hospital?
Yeah, I don't have that information for you, Marcos.
Almost none, Marcos. There's probably, I can count in one hand the number of 30-year-olds of them. We've had 2, I think, 30-year-olds in the hospital since this whole thing started.
I think you're right, Doc. I think the younger folks are a little more able to bounce back quicker, so we don't see those in big numbers in the hospital.
Well, and
Thank you
being
very much.
asymptomatic. Go ahead.
This is Stacy. I was just going to say the problem is then who do those younger people come in contact with? So yes, they can rebound from it quickly because they are younger and stronger. But then when they get around their parents and their grandparents and others that are compromised, that's where the hospitalizations come from.
Well, I think that's one of the biggest issues with is the fact that, you know, it doesn't affect them as much. It's not as big an illness to them. So they, you know, they don't know if they have sinuses or if they have COVID. And so they're out there running around, like you say, they're getting with somebody who's immune compromised or elderly. And that's where the big concern is.
Thank you all very much.
Thank you, Marcos. This one, 41 minutes, pretty informational for everybody. We're going into the weekend. We'll be back Monday. Russell, did you want to finish us out with something?
Yes, sir. Again, as we've all echoed here today, wearing the mask not only protects you, but it protects the next person. But it's only good if people are wearing it. Having it in your pocket or hanging off your ear isn't enough. It needs to be, you need to be covered up. And can you imagine if we all were covered up, what that would do to the spread, how that would slow that down. So please, let's all do our part, be part of that. The thought I have for today comes from Ephesians 4:2 that says, be completely humble and gentle, be patient, bearing with one another in love.